So we're going to talk about a drug. So this drug comes with in a couple of brand names, including the famous ones, Vascopan, and we have Copan, and I think many other brands in the market. So each tablet contains Hyoscine butylbromide 10 milligrams. So this drug, Hyoscine butylbromide, is a spasmolytic. This anticholinergic spasmolytic effect is based both on the competitive inhibition of the activation of the parasympathetic system of smooth muscle mediated through muscarinic receptors, and more markedly through ganglionic blockade or neural transmission. So what you see is it's by inhibiting the parasympathetic action, you see an anticholinergic or an anti-muscarinic effect, or you see a spasmolytic effect. So pharmacokinetics, Hyoscine butylbromide is a quaternary ammonium compound, and as mentioned, it has an anticholinergic agent. It is an anticholinergic agent which has a ganglion blocking component, and due to its anticholinergic action, actually this is part of the PD still. So Hyoscine butylbromide reduces the tone and peristalsis of smooth muscle in hollow organs with parasympathetic innervations, such as the stomach and the intestine. And it has low lipid solubility. So it's a quaternary ammonium compound. It has low lipid solubility. It's not able to cross the blood-brain barrier easily, and it rarely causes nervous system side effects. So rarely do you see side effects related to the CNS, associated with atropine and hyoscine. So it is a powerful smooth muscle relaxant. So it is effective when given by mouth or by injection. So in the recommended dose, it relieves smooth muscle spasm quickly, and you rarely see atropine-like side effects such as blurred vision, palpitation, or dry mouth. It is poorly absorbed from the GI tract, and it is rapidly distributed. Based on the calculation from the plasma levels, the bioavailability of oral Hyoscine butylbromide is about 0.13%, so about 0.1%, very low. So upon oral administration, the drug concentrates especially in the tissue of the GI tract, liver and kidneys. So this drug has a very short half-life, T-alpha of 3 minutes, which is the distribution phase of the blood levels, and the excretion rates are slow. So which is a reflection of the high affinity of this agent to the tissue, according to the package insert. So despite extremely low blood levels, measurable over a short period of time, Hyoscine butylbromide, it remains at the site of action in the tissue in high concentrations. So what are the indications for the drug? This includes GI tract spasm, spasm and lack of movement, dyskinesia of the biliary system, okay, the gallbladder and the bile duct, common bile duct, and also the genitourinary tract spasm, okay, any spasm related to the genitourinary tract in the ureter spasm, the urethra, that spasms too. Then I'm not sure whether that can happen or whether that's common or not. But if there is a spasm with a GI or GU tract, then you can give hyoscine butylbromide. So the doses that are recommended, for adults and children above 6 years, it's 3 to 5 times daily. So it's 10 milligrams 3 times a day or 5 times a day. Okay, you can take 1 to 2 tablets. Okay, so it's 10 to 20 milligrams 3 to 5 times a day for adults and also children above 6 years. So the tablets should be swallowed whole with adequate fluid. Okay, it's taken orally. Contraindications include stenotic lesions of the GI tract. Okay, so you don't want to move the stenos area of the GI tract. Prostatic hypertrophy. Okay, hypertrophy of the prostate gland with urinary retention is a contraindication. Myasthenia gravis, okay, because you don't want to aggravate the anticholinergic effects. Okay, glaucoma, tachyarrhythmias that are pathological, megacolon, and also which is obviously known hypersensitivity or allergies to hyoscine butylbromide. Warnings and precautions and warnings in pediatrics. As for all anticholinergics, infants and young children are susceptible to the unwanted effects of anticholinergics. So close supervision is recommended for infants and children with spastic paralysis or brain damage, because we know that an increased response to anticholinergics has been reported in these patients, and therefore adjustments of the dose are usually required. So when anticholinergics are given to children where the environmental temperature is high, so there is a risk there of a sudden or a quick increase in body temperature, because these drugs tend to suppress the sweat gland activity. It suppresses the sweat gland activity, causes less sweating. So that's a bit dangerous. You can get hypothermia, and a reaction that is paradoxical, that is characterized by hyperexcitability, may happen in children taking large doses of anticholinergics. So that's for pediatrics. As for the old people, geriatrics, they might respond to the usual doses of anticholinergics, which is 10 milligrams to 20 milligrams 3 to 5 times a day. With excitement or maybe agitation, they get agitated, they might get sleepy, drowsy, or they might just get confused. And the geriatric patients are they are susceptible to the side effects of the anticholinergic side effects, including constipation. Okay, they get dry mouths, constipated. They might develop urinary retention. Okay, especially in males because of that prostate thing. And if these unwanted effects happen and continue or are severe, then the medication should probably be discontinued. Okay, that's part of common sense probably. And it's also caution is needed when giving anticholinergics such as this drug, hyoscine butylbromide, to geriatric patients, the older patients, because of the danger, okay, because of the risk of precipitating glaucoma that is undiagnosed. Okay, precipitating undiagnosed glaucoma, there is a risk there. Okay, you don't want to precipitate the glaucoma due to your blockage of the cholinergic system. Okay. And since that these anticholinergics block the action of acetylcholine, okay, which is responsible for many functions of the brain, especially including memory functions. So the memory in these geriatric patients may become severely challenged, okay, impaired, especially with those who already have memory problems. Okay, so that's dental after geriatrics, and before that pediatrics. So now we go to the dental issues, warnings, precautions. So prolonged use of anticholinergics, including hyoscine butylbromide, may reduce or inhibit salivary flow, so thus contributing to the development of caries. Okay, so you need saliva, you need wetness, moist in your mouth. If not, if it's just dry, which happens when you are sleeping, so contribute to the development of caries, disease to the periodontal disease, oral candidiasis, and also discomfort in the mouth. Interactions with other medications. This drug can potentiate the effect of tachycardia that is induced by beta sympathomimetics. And also this hyoscine can precipitate also or potentiate the anticholinergic effects of other drugs such as guanidine, amantadine, tricyclic antidepressants, such as amitriptyline. And then we have it can also potentiate the anticholinergic effects of antihistamines, disopyramide, phenothiazines, belladonna alkaloids, and also monoamine oxidase inhibitors. And also the concurrent use with a dopamine antagonist, okay, dopamine antagonists such as metoclopramide can reciprocally can antagonize the effect on the GI motility. So you have to be aware of that when you use hyoscine together with metoclopramide. Okay, metoclopramide is commonly used to treat vomiting and nausea. So safety during pregnancy has not been established. Okay, with regards to pregnancy and lactation, safety has not been established. But however, the preclinical data that is quite limited so far have shown no hazard. So as usual, we have to observe precaution during the first trimester. And also safety in lactation has not been established. For scopolamine, scopolamine crosses the placenta, and studies with scopolamine have not been done in either animals or humans. Okay, and breastfeeding for all anticholinergics, including hyoscine, it might inhibit lactation. Okay, adverse reactions: dry mouth, reduced sweat excretion, impaired micturition. You can see tachycardia, which is rare. So when it recedes, okay, it recedes as soon as the drug is withdrawn. And you might see hypersensitivity reactions such as urticaria, rashes, facial and periorbital swelling. Okay, these all have been reported. So overdose. So signs of poisoning following acute overdose have not been observed in human beings. Okay, and single overdoses of up to 590 milligrams, and when the active substance is up to 1090 milligrams within 5 hours, you will just produce things like dry mouth, tachycardia, slight drowsiness, and transient visual disorders. So in the case of oral poisoning, you might do a gastric lavage with activated charcoal followed by giving magnesium sulfate 15%. Okay, for patients with glaucoma, you can give pilocarpine orally. Can boost circulation with sympathomimetics. Okay.